Family-Centered Intervention Plan by Haley Wingo. Step 1. Educating the family. The first step to making sure the family is involved is to educate the family. It is important that the family members are aware of the diagnosis of the patient. With giving the family the proper information and knowledge, they will be able to be far more helpful in intervention. This is because the parents' awareness and knowledge have been assessed traditionally from the perspective of professionals. Recently, the literature stated that proper interrelations between parents and professionals during the early interventions are crucial for both coping parental stress and involvement in the rehabilitation as well as a higher child's outcome. Step 2. Discuss needs and goals together. When looking towards the needs of the child, it is important to also ask about the needs of the family. Each family has different needs and concerns. It is important to sit down and listen to the family and share its ideas and goals. The works by joining the family in a manner that conveys respect, builds trust, and establishes effective partnerships through uh, partnerships, parents and professionals listen to one another and seek joint perspectives. This builds a better relationship that will lead to more success for patients. Step 3. Include family in treatment. Parents and other family members spend the most time with the patient. When creating a treatment and therapy plan, allowing the family to be a big part of this can make far quicker progress than solely relying on professionals. This is because family centered practice has since then been widely used as elaborated and substantiated over the years. Support that involves the families who usually spend most of the time with the child is more powerful than exclusively child centered intervention. Family issues. A family member who has a lot of underlying health issues and tends to dominate your patient's appointment by discussing their own health problems. In this situation, I would try two techniques. The first would be to listen carefully to this person, then chime in by saying, well, your own struggles will allow you to be supportive towards your family member. Then I would tell them I want you to listen to them and think about how you can be supportive. This way, it gives the person a task that will encourage them to be quiet. And then, if this doesn't work, I would then go to the second technique, would be to make the excuse that at some point in the meeting, I have to talk to one on one alone with the patient. I would then kindly ask them to give us privacy to make it seem like it's just routine. Family issues. A very supportive family member who has done their research and informs you they know exactly what the patient needs. In this situation, I would give some praise to the family member for being so devoted. I would also tell them that their ideas are great, but that there is a protocol in place that we typically follow first before we try that treatment. For example, let's say that your patient has a moderate hearing loss that can be treated with a hearing aid. However, their family member wants a cochlear implant. I would tell them that a cochlear implant is a good idea. However, we typically try hearing aids first because before doing a major surgery. Family issues. A spouse who is very negative about how their significant other will do with the treatment you have recommended. In this situation, I would ask the spouse to be the accountability toward their partner. This way, the spouse feels involved and can be supportive of the treatment. It will also help their partner follow the treatment by having someone remind them of how important it is to do what is recommended. I would also tell their spouse that it is an adjustment and most people take time adjusting to new changes. These are my wonderful citations. I hope they gave a lot of information and I hope you enjoyed it. Thank you so much for listening.